back with certified sex therapist Emily D'Ayala, who is taking your calls. The number is 713-284-1055. Let's go to the phone lines. Good morning, Virginia.
Hi, how are you?
Good. What is your comment or question for Emily?
Well, my comment is, and my question is that what I was wondering, is there a reason, is like if you have, I've had a hysterectomy, and I don't seem to...
Your desire is kind of
I
gone
don't
away?
I won't say I don't have the desire, but it seems that I have not had sex in a while because I lost my husband right after that.
Okay.
And so I just was wondering, is there sometimes that when women have a hysterectomy, they no longer have the desire, or...
Yeah, and I think there's a psychological and an actual hormone reason for that as well.
Absolutely,
so both of those
right.
together can be a double whammy.
So some hormones are produced through the ovaries, and so if she had a total hysterectomy where both the ovaries and the uterus were removed, there can be some issues, maybe because...
Yeah, because hormones and it's part of your sex drive.
Absolutely,
They can drive that sex
yeah,
drive.
and the older women get, usually estrogen levels start to decline. Estrogen is really important for vaginal lubrication, so a lot of women who are postmenopausal will describe feeling some of the sexual pain symptoms that we talked about because they're not lubricating naturally anymore.
Right.
Lube is your friend. There's lots of great lubes available on the market, but also psychologically too, women who go through things like hysterectomy, or who have had cancer, maybe breast cancer, something like that, there can be a lot of associations of not feeling a woman anymore, which can definitely impact you sexually. And so, you know, definitely seeing a therapist or counselor to help deal with that transition can be helpful.
Yeah, and I would imagine, too, the other thing is having lost her husband, sometimes you
Right.
go through the guilt of moving on.
That's true.
So you have to get over that, too. All right. Marta. Good morning, Marta. Marta, can you hear us? Hello?
Yes.
And what's your question or comment for Emily?
Okay. I have a UTI, and this is the second time I've used it. And I have the UTI that it's 5 years.
Okay.
And this second time, I can see it more of the side effects where I have no drive. And even in the beginning, it was like no drive whatsoever. Now, all that, when we're intimate, my husband is the one that, you know, gets us there to where I feel the drive. And we have very good sex. But is there something I can do or I can take to
So the
increase the
connection.
drive?
So
I'm
she's
not sure
using
she's
the
saying-
UTI. I think UTI.
You mean
yeah, the
IUD?
UTI. I think.
UTI, I'm
yeah,
sorry.
yeah.
IUD.
Okay. Oh yeah, I was
Okay.
going to say UTI, urinary tract
Right.
infection, or
Right,
yeah,
right.
yeah,
IUD.
for birth control. Okay.
Right,
We
right.
oftentimes can say, you know, sometimes the birth control pills can impact that sex.
That's true.
But didn't realize that could happen.
IUDs, I would say less so. So it sounds like there may be something else going on that could be impacting her drive. The other thing to keep in mind, and I think she kind of made mention of this, is that a lot of times we assume that sexual response happens linearly. So first you have sexual desire, then you have physical arousal, then maybe you do or don't have an orgasm. But that doesn't always happen that way, especially for... So sometimes, because I heard her say that she and her husband still have really great sex,
Yeah.
but that maybe it's usually him initiating.
Yeah, you're
and
a
that
lucky
can
girl.
Be, yeah, so that can still be okay. Sometimes it takes a little bit of physical touch or affection, then the arousal kicks in, then the desire kicks in.
And I
So
would
it
imagine
doesn't
that
always happen one
oftentimes
way.
seems like it's more the case for women, that we have
Definitely.
to kind of work our way up to it, if you will.
Absolutely, and that's fine.
Okay, so
Yeah.
and I think you hit on a great point that it doesn't mean what you're doing is wrong. If it's
Right.
if it's happening for you, it just happens a little bit
Exactly.
differently.
You know, when it comes to sex, please remember there is very little normal.
Okay.
There's very little normal.
Yeah.
It's about figuring out what's normal and healthy for you.
Create your own normal. All right. Good morning, Diane.
Yes.
What's your question or comment?
My question is, where can I find a sex therapist? And is it typically covered by insurance?
Okay, we have one right here, right? And no,
That's right.
yeah, asking, so is it typically covered by insurance? We know that, unfortunately, a lot of types of therapies aren't.
Right, right. So a lot of the more specialized therapists aren't covered by insurance. To my knowledge, in Houston, the people who do specialize in sex therapy don't accept insurance. But that being said, you can usually file with your insurance company for out-of-network benefits. My website, HoustonSexTherapy.com, I have a list of questions there that you can ask your insurance company to find out exactly what they'll reimburse. And those questions you can ask, for
Yeah.
any therapist who you see.
And you have to
who
ask
see.
yourself, what's it worth to you? You may get
Exactly.
through a couple of sessions with
Right.
Emily and go, and the light comes on,
Right.
and move on. Because you give people tools to work with so they can help
Absolutely.
themselves.
I'm thinking of this one couple who they were going through fertility treatments. They had spent thousands of dollars on the IUI method. And the reason they were doing that was because every time they were sexual, he would lose his erection because the pressure had built up
Right,
so
right.
much that, he has to take advantage of these 1 or 2 days when she's ovulating. If they had come to therapy for far less of the cost, I probably could have helped them with
Yeah.
that.
All right. Good. Tanya. Tanya, can you hear us?
Yes, I can.
All right. And what's your question or comment?
First of all, good morning.
Good morning.
I was wondering, when me and my husband have sex, it seems like as soon as he puts it in, he has an erection. What is the cause of that, or how can we stop that from happening so fast?
Okay, you're saying he has an erection, or he comes to his arrival point as soon as he gets there?
No, as soon as he puts it in, he has an erection.
I think maybe ejaculation.
Yeah.
Right.
Yeah.
Well, you know.
I was gonna say because
Right.
usually when it gets in there, it has to have it's
Right.
Oh, there we go, right there. right. Okay, so
Right.
which that oftentimes can be a problem because timing is
can.
different. You
It
gotta
is.
time that out.
It is. You got to time it. We talked about the general averages for how long it takes men and women, but there's everything across the board, and there are different techniques that men can do to help with that a little bit. Sometimes just slowing down is all it takes. Sometimes minimizing the arousal that happens before penetration can help, because if someone's so excited that by the time they reach that point, then they may, ejaculate too quickly, for her satisfaction. The other thing is some positions men find more arousing than others. So I always encourage them to learn their arousal continuum. If you think of everything that you're doing with your partner sexually, what's the least arousing, what's the most arousing? And try to maybe start with less arousing things sexually and work your way up. That can help
Is this the
elongate
case where some of the
process.
things like Viagra and Cialis can help with, or?
So Viagra and Cialis are primarily working on erectile dysfunction, which is different from ejaculation. But some people do feel that it does help
Prolongs
elong
the-
that
yeah.
a little bit.
But if it's any more than 4 hours, you're supposed to call a doctor. That's
Right,
what they say.
that's true.
Yeah.
That's true. The other thing is you want to think about the refractory period. So usually for men, there's a time between the which they have their ejaculation and their ability to get another erection. For some men, that point is very short. So just because he has his orgasm, he may be able to get an erection relatively quickly.
Yeah, all right. We have Pam. Good morning, Pam.
Hi.
And
I have
which-
a question.
Okay.
The question is, I have a urinary infection. So this has been happening over a year. I've gone to 3 urologists and finally got one here in Pasadena that is, did the Botox therapy, and he did some research in my bladder and everything. But I'm afraid to even start a relationship, and I'm 64.
Well, first of all, good for you for even thinking about starting a
Right,
relationship.
right.
I watch
but-
you every day.
Oh, thank you. Okay, so
So chronic UTIs or urinary tract infections are something that a lot of women do suffer from, and some research is coming out suggesting that women who maybe have been on birth control pills for a long period of time are maybe a little bit more likely to have different kinds of vulvar irritation issues, and that can manifest itself sometimes with chronic UTIs. Sometimes doctors will prescribe a little mini antibiotic that you can take the day before, the day of, and the day after you're sexual, and that can help for a lot of women in preventing those UTIs. But if she's described, if it sounds like maybe she's got that part under control, but that she has some fear developed now in starting a new relationship, which is totally understandable. There's lots of interventions that can help reduce that anxiety so she feels more comfortable moving forward.
and oftentimes the fear stops us, but trust
Right.
me, that guy is like, woohoo, he
Right.
doesn't care. Right, you're good. You're good.
Right.
Well, Emily, it's always interesting when we have you on because there's obviously a lot of interest out there. The
Sure.
phone lines are flooded, so we'll have to have you back soon. But thank you very much.
Thank you.
If you'd like more information on Emily's practice, just log on to our site at greatdayhouston.com. Well, today on Facebook, we want to know what incorrect things did you believe for way longer than you should have as a kid? My mom told me swallowing watermelon seeds would make a watermelon grow in my tummy. I was terrified for years. So log on, let us know what you believed. And in fact, Callie, who's our intern, what incorrect thing were you told one day? You were in our office yesterday telling us what your dad told you?
Yes, my dad actually would make breakfast in the mornings called Eggs in a Basket, and he said he made them for kings and queens all over the world. But then I had my friend Bailey come over, and I was 17 years old at this point, and I said, my dad made this breakfast for kings and queens all over the world. And he was like, Bailey, she's just kidding, and I was shocked.
And Callie goes to Rice University. What happened there? How did you get in? All right, we'll share some of your comments later on in the show. Does anybody know what this little thing is right here? Let me just tell you that green means serve more meat, red means no more meat, and yellow, or this like part right here in the middle, means I'm thinking about it or I might want dessert instead. And by the way, it has nothing to do with our previous conversation. Find out what this really means coming up next.